When we look at Silver Cross Medical again, we can see they also have a pull down menu of different areas, kind of like up here. But I pulled down emergency department care. They have emergency visits and deliveries and all these numbers and things of information, but they create no graphs. This is just intake of numbers and information, and that's really hard for people to remember or understand what they're supposed to do with. Same here. This is Loyola, which also does medical research and schooling. And so they have clinical trials. Well, all they have about that is to see what's active or participate in one, but it doesn't give us information about, you know, if the clinical trials have worked or how many they do or what they do well in. Or here we could have bars and graphs and charts to show us, what Loyola is actually doing with this research. The next is images. I'm going to spend a little bit on this because it is very important to have images that emotionally engage our audience and attract the eye. We want to create a mood for our hospital when people come on to the website, and the sort of feelings that we want to get out from these images are ease of access and cleanliness. We want to make them feel comfortable with their surroundings. We also want confidence and success. We want people to get the feeling that our business is doing well. And although it's less of a business than some other sites, it still is. And especially for a hospital, we don't want people to feel like we're a failure. Because when that happens, people get anxiety and stress. They become very fearful of a bad hospital if we're not promoting our success. And the last thing is we want people to have sort of diversity and peace and happiness when they see it. Hospitals and any medical facility aren't very happy places all the time, but we want people to visit and stay long. We want people with family members to feel welcome, and we want people to feel like their loved ones and themselves are in happy, healthy, capable hands. So the first is UCLA. And UCLA, these are going to give our examples of how we do ease of access and cleanliness. Because here you can see a family on the computer and it says access around the clock. Obviously, they're using the UCLA site and it looks like they're not stressed at all. They're not trying to find a doctor. They're not having a hard time finding a location or what they need to do. So you can tell by their face they can all do it. The kid can do it. They have the kid actually going on the computer. That's how easy the UCLA site is to use. Here, it's schedule a little U time. They use the cute U in there. And what this does is, as a happy person, it's obviously a wellness checkup. It's hard to get people to come to a hospital and do wellness or any sort of checkup. People are scared of hospitals. They're scared of being sick and what happens in hospitals. So this is convincing people, just come and get checked and nothing bad will happen. This person's happy and the doctor's happy and everybody's having a good time. It's a calming effect. These are calming, nice, easy pictures. And there's a diversity of having the woman doctor here and the African American gentleman is the patient. So we're creating a really nice, safe area for people to join. Now, when we look at our second sort of example, we're going to be looking at the success and confidence. And that's going to be with Johns Hopkins. Johns Hopkins has some of my favorite pictures and really one of my favorite sites for all of this. Here, we see they have popular scrolling through images set up. So that's a very popular thing for a lot of websites and hospital websites, is to have multiple images with things going through them. And one of them is the building and building our promise. So what I like about this is that you can't really see in anything, and it has the reflection. So this creates a really nice feeling because it makes us think of their building and technology altogether. It makes us think they're well off and that they're thinking about us and what they're building, and they want us to have the best. And with this, it's like shiny, new, prestige looking and classy. But at the same time, it's this like watery blue with the reflection that's got this calm and peaceful feel of it. So it's not coming off super pretentious. It's calming and professional at the same time. This is one of my favorite pictures ever, and it is this doctor in the middle, and then it has the technology on the side, and it's the innovations in patient care. What I love about this is that we have this expensive, clean, prestige, you know, obviously equipment in the back, and we're showcasing what Johns Hopkins can afford for their patients, what they're going to go out there and get for their patients, and how they're at the edge of technology. And that's important. That means they're doing well. That means they can get these things. And also, it's a nice sterile white background, and in the center here we have this doctor, and this doctor has this confidence and air about him. We can see it in his stance, we can see it in his face, but he doesn't come off as aggressive towards us. Instead, he comes off just as this really confident person that's basically saying to us, I know I can do it, and I'll be here, and I won't let you down. That's the stance and face we get from this doctor and how it's centered. And I really love these pictures to create that. For the next, we have creating this diverse and happy and peaceful feeling. Now, Amita, as we had seen before, has these buttons that they use pictures for. And we can see in each of these, there's something different. This is incredibly diverse. We have doctors and nurses of men and women. We have different races and ages all together. We have families. We have children. It is just diversity all over their site. And that's important because it matters to see yourself in an image when we're looking at an image. And they really make it so that anybody can visit their site and see themselves somewhere. Again, we have older people exercising together. We have happy people that look loving with the Cancer Institute and the Heart and Vascular Institute. You know, a lot of heart problems are important, and it puts family together, and there's togetherness in that. Like I pointed out before, it's the couple with the baby, and they look comfortable and they look ready, and the children are playing and fun, and there's all kinds of different children, different ages, different types and genders. So this is very important that they create this. They create family and diversity, they create togetherness, they create happiness. When we look here, Hazel Hawkins Memorial Hospital, they also use the popular scrolling, and this is one of theirs, is the compassion. You could tell by the look on their face and togetherness. It's just a powerful picture of happy people, and they seem to care about each other in this picture. And that's also true here with Duke. They do not have a scrolling image system, which is different. And not a lot of sites use just one static image, but they do such a good job here because this patient doctor interaction is just amazing. You can tell the happiness, the caring, and they seem to actually have a personal relationship in both of these images. And that tells people that it'll make them feel protected. It'll make them feel happy and safe. Some of the bad we're going to look at again with the Belleville Hospital is that they do have scrolling images, but these are two of their images. One's about a golf tournament for sponsorship, and one's about being top 10% in the nation for general surgery, which is great for them. But as you can see here, Duke does a similar thing. They use their award, but they put it with their image. This is just an award. This is just information, and this is something about golf. It really doesn't give us that warm and fuzzy feeling. Same here with Cedars-Sinai, is that this is an important thing. We want people to stay connected and use their social media with us, but it's an image that has no feeling. There's no interaction with this image. There's nothing here that makes us feel safe and at home in these images. They're very static. And so, in conclusion, when we create our website, we should strive to integrate all these elements I've talked about. Visual organization so that our site looks professional and is easy to use. We want visual simplicity to minimize the tension and make everything easy to see. We want to have interactivity to engage users and keep them on our site longer. We want graphs and charts to tell information that is easy for viewers to understand in a format that they can remember. And then we also want images selected carefully so that we can emotionally engage viewers and make them feel safe and comfortable in our hospital. I hope you took a second to think about all this, and then we can put together a great website that can do all of these elements. Thank you.